On behalf of the Centers of Medicare and Medicaid Services, the Administration on Aging, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I'll be the moderator for today's webinar. First, before we begin, I'd just like to apologize for the delay in the webinar start, and we do appreciate you hanging on. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you can see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. However, today's question and answer period will be at the end of the presentation. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You'll receive an answer in the Q&A box. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on CMS.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Cultural Humility, Empowering Elders Through Engagement. Today, we have several presenters that have joined us to share their knowledge and experience. I will introduce each person. We have Debbie Dijak, who has served as the Education Coordinator at the Archie Hendricks Senior Skilled Nursing Facility on the Tohono O'odham Nation since 2011. She has been an adjunct faculty member with the Arizona Geriatric Education Center and the Geriatric Workforce Enhancement Program. She holds a bachelor's degree in nursing and a master's degree in support psychology, specializing in wellness and stress management. Since 2015, Debbie has been an integral leader for the Uniting Nursing Homes and Tribal Excellence Group. Agnes Wong is the administrator for the Yukon-Koyuk Elder Assisted Living Facility in Galena, Alaska. The facility is a tribally owned and operated ALH for primary tribal elders. The mission is to honor our elders by providing safe and compassionate care and support in a culturally sensitive home. Regis Pescos is the co-director of the Santa Fe Indian School. Joseph Wray is an independent living specialist. He has spent 25 years as an advocate for Pueblo people with disabilities. Joseph is a Laguna Rainbow Corporation Elder Care Services Board member, and his focus for elders is long-term care and community-based services. Jordan Lewis is the director of the National Resource Center for Alaska Native Elders and an associate professor for the University of Alaska Anchorage for the WWAMI School of Medical Education. He is trained as a cross-cultural community psychologist and social worker and a credentialed professional gerontologist. Gary Ferguson is a licensed neuropathic doctor living in Anchorage, Alaska. For the past 16 years, Dr. Ferguson has worked across Alaska to address the social, economic, cultural, and environmental factors that contribute to the health and well-being of Alaskans. Thank you to all of the presenters for joining us today. I will now turn it over to Debbie to provide an introduction to today's topic.
Good morning, good afternoon, everyone. Thank you for your patience. Just briefly, the learning objectives for today have to do with defining cultural humility and understanding that relationship in long-term support services with patient-centered care. We will be talking about some challenges related to cultural humility, especially in a long-term setting. And we will talk about understanding the empowering benefits to the elders, to the staff, to the family, and to the community of using this approach. Ultimately, we want to find ways to help our elders settle in and feel at home. As Julie mentioned, I co-lead UNITE, the Uniting Nursing Homes and Tribal Excellence Collaborative. The Tribal Nursing Home Collaborative is open to all tribal nursing homes and assisted living facilities across the country. We formed in 2014 We have monthly calls. We have a steering committee that also meets monthly and an annual meeting. And we are committed to establishing best practices and building relationships nationwide with our identified stakeholders. We work closely with Indian Health Service, with Administration on Community Living, with CMS, and some of our stakeholders include the QIOs, along with the GWEPs, the Geriatric Workforce Enhancement Program. We are open to membership with the Ombudsman and cultural experts and educators. The collaborative was formed to promote opportunities for tribal nursing homes to network, discuss best practices, and promote evidence-based education and training. And we want to work towards the common goal of providing culturally responsive and exceptional care for the elders throughout Indian country. We do have a website, and we can also be found on CMS.gov.
So cultural humility, it can be roughly defined as a lifelong process involving self-critique and self-reflection, and this idea that there's bidirectional learning. So you are in a position where you understand you don't know everything about the individual or the culture, and you can learn from the elder that you're interacting with and spending time with, and they can learn from you. And so there's no experts, but you are the experts about your own identity and your culture. And cultural humility also kind of gets at that power imbalance between a provider and an elder, and being aware that that exists and taking time to set that aside and understand that you can learn from them. So you want to develop mutually beneficial partnerships. And I would like to also point out the difference between cultural competency and cultural humility, where cultural competency can be understood more of an intellectual understanding of culture, and it's built on understanding other cultures to more appropriately provide services, which is also a good thing. And it's more based on academic knowledge and learning, with this idea that you may work towards becoming more culturally competent, versus cultural humility, this idea that it's more of an introspective understanding of culture. It's continually evolving. It's a lifelong process, and it involves personal reflection and growth. And you're doing this more to increase your awareness of the differences that exist, and there's really no end goal. And so when you think about cultural humility, some examples, and we'll definitely cover more of these throughout the presentation, to practice cultural humility is asking open-ended questions, use reflective listening to understand their perspective, what their concerns are, their thoughts, their ideas, and through listening, finding strength in the culture, strength in the elder you're working with, and then finding ways through interaction of seeking and learning from their experiences. So I'd like to turn it back over to Debbie.
All right. Thank you, Dr. Lewis. Appreciate that. Our next slide says the process of attaining cultural humility, and I would like to invite Dr. Gary Ferguson to speak.
Yes, good morning, everyone, from the great land of Alaska. So, as we settle into talking about cultural humility, as Dr. Lewis has shared, it's really about understanding that many of us will never fully understand somebody's culture, but we, through the process of active listening and really being inquisitive, we can discover ways that we can work with people and honor their cultures. And when we think of cultures across Indian country, we have currently 567 federally recognized tribes, and here in Alaska we have 229 tribes. So when we think of, even I'm a tribal member in the Aleut region, the Unungan people, and as I travel, I learn so much about our cultures, and I'm learning all the time. And so for me to see through my perspective, I have to also listen and learn and engage other cultures, and it's fluid, depending upon the age of our elders. Certain things that we may have as maybe even a stereotype of that culture might not exist. So it's really important to listen and to engage elders. And we're going to talk further about this topic, but really helping elders settle in and help them understand that we want to honor them with, what are your food preferences? What are some of your cultural foods. And when we think of honoring that piece, elders feel so nurtured and cared for when we ask those questions and we work at finding ways to prepare and access these traditional foods. And there's some really wonderful best practices across Indian country of providing these cultural foods that truly are like medicine. They're truly soul food, and they allow for elders to settle in and feel like they're being honored. And I'm going to hand it back to Debbie.
Okay. Agnes Sweetser, would you like to also speak? Is Agnes? Okay. All right. We're going to also talk a little bit about the importance of cultural humility. And the reason we put this iceberg picture here, other than in honor of Alaska, is to think about the deeper aspects of the work we do and some of the importance of things that maybe we don't always think about. And so I'd like to invite Joseph Wray to speak to us right now.
Good morning, everyone. Thank you. Joseph Wray from Laguna, Pueblo. Well, here in New Mexico with our 22 tribes, 20 of them, 19 of them, the Pueblos, and then the Apache, and of course the great Navajo Nation. We have quite a mix of cultures at our nursing facility in the Pueblo here, and so maintaining that the folks' ties to the culture, I believe. Now that I'm an elder, in my perspective, serving on the board of directors for the nursing home, our folks really appreciate being as close as possible to their home communities, and through the families, they maintain their ties to the culture in the best way they're able to practice. For the people, participation in the ceremonies is so key, but when a person has reached a point in their life when they need nursing home placement, it's very difficult, again, for those individuals, unless they have strong family who can transport them to their home communities, which can be a few miles away and up to hundreds of miles away for our non-Pueblo members. It's really hard to, again, maintain their ties to the culture. The various communication methods, again, because of our diversity of our communities, we have almost up to 10 various languages that are spoken by our residents in our nursing homes. So being able to convey yourself and the delivery of care in an appropriate manner, again, is a big challenge. It varies from tribe to tribe, Pueblo to Pueblo. Again, how someone at a CNA administers care, very key in maintaining one's cultural humility, as was explained by the doctors. Again, the broad issues may impact elders, such as the financial impact that they're receiving at times. Some of our residents are aware of the financial process because they, again, are involved in the Medicaid application in our facility. 99% of our residents are Medicaid, institutional Medicaid, financially financed. So again, the families are at times not aware of what how the financial side of nursing home placement can impact their elders, and it can be a heavy load, a stressful issue for our elders being placed in the nursing home. So it's very, very key for our staff there at in our nursing home to be able to convey the fact that they are looking out in the best interests and establish those healthy relationships of caregiving. Many times our elders have been so independent, and giving up their independence as far as their care is really another challenge in maintaining their dignity and their maintaining their self-esteem. And again, the goal there is for a healthy placement, a healthy transition into the life of the nursing home, which can be scary for non-tribal nursing homes. So again, it's very deep, so many issues, and again, we're thankful to have Unite trying to bring these issues and best practices to the forefront. And again, thank you, Debbie.
Thank you, Joseph. Agnes, are you on the call? Are you hearing?
I hope
Yay.
so.
Yay.
Do you hear me? I'm sorry about that. This is so synonymous to practicing cultural humility in a broader world. But thank you for your patience. I think you've hung in there this long, but that's a good indication that you are going to practice cultural humility. I looked at this slide of the iceberg and really struggled with it. And then I got to realizing that really was related in so many ways to cultural humility. We all have really good intentions in our practice and want to do the best job that we can. However, we don't always experience the outcomes that we want. People criticize and complain. Our customers, our elders don't seem happy. And to me, cultural humility is about looking at things differently, looking at what's actually underneath, what this iceberg is about. For example, in 2013, we experienced the worst flood in history. So I couldn't appreciate the beauty of this iceberg. It all but destroyed my life. So I had to reflect on that and cultural humility, and then it just came so clear to me that culture, for a lot of our elders, they were punished for practicing their culture. And so now this is new to them and frightening to them, and a lot of us don't know what we're doing. We need to look at caring for them differently. We need to break away from practice as it is, and especially if it's not working. We need to humble ourselves and feel confident enough to ask for help and change the way we practice and take care of them. We need to honor, cultural humility to me is about honoring a person for who they are. And I think I appreciate that more and more as I mature. I'm Athabascan, from Alaska, and my cultural values continue to grow more important. And I have to remember that as it is so much who I am, it's even more probably who the people that I'm caring for, who they are. And to I've learned ways to be able to honor that and practice, and, I'm more than happy to share that.
All right. Thank you very much. Would any of the other speakers like to comment on this slide? I appreciate that, Agnes. We also wanted to touch on this cultural humility and the relationship there with patient-centered care, elder-centered care. And so I'd like to call on Dr. Jordan Lewis.
Great, thank you. So I just want to, thinking about the relationship between practicing or engaging in cultural humility and connections to elder-centered or patient-centered care, And thinking about, we've touched a little bit about some of the skills, some of the techniques we can use, not only for ourselves, so this idea of self-reflection and skills we can use within our honor model for caregivers, or ultimately that we have good intentions, but we can always fine-tune our skills. We can learn from others who are practicing cultural humility. And so as we think about developing skills for caregivers and for ourselves and others, we need to also remember to be open to changes, be flexible, because what may work for one person may not work for somebody else, and not making these assumptions across cultural groups or gender or different experiences of cultural groups that they all have the same experience or same beliefs. And so being aware of how to ask questions, what would be some culturally based practices that may be appropriate for individuals. One example I learned from a mentor of mine is that a lot of Alaska Natives like to eat salmon, but we're realizing that they don't all like it the same way. So thinking about how we prepare traditional foods, what are some preferences? One example of what's been done in a facility in Alaska is engaging the elders in sharing recipes and preparing foods. And so getting them engaged, finding out what their preferences are, and also learning from them on how food preparation can be handled. So also thinking about honoring preferences, again, being flexible. This could include, we've talked a little bit about communication, but also traditional foods, type of music they may enjoy, religious preferences, what are some protocols around family engagement in care, family engagement in the facility, being involved in the elder's life, around also in terms of healthcare beliefs, because, they may be coming from a different background, different understanding of what healthcare means, and being open to different approaches to care, different illness beliefs. And so thinking about all of these and how we can focus on these and build on them and continue to be open to the idea that we're continually learning how this all works. So thank you, Debbie. I'll pass it back to you.
Okay, thank you, Dr. Lewis. Do you want to make a comment also?
The line will remain muted until the conference leader unmutes your line.
Okay, I don't know what that was all about. But anyway, I think even before trying to give skills to the help them attain skills, our caregivers, we need to give them permission to be, culturally sensitive, practice cultural humility and all that, because what I have found is that caregivers really want to do a good job, and the measurements are in that things are clean, patients get their showers, and those kind of things. But we need to give them permission to really connect with the elders and to take that time to slow the tempo down, to listen more, I see caregivers not so much as giving care, but as partnering with the elders and helping them to take care of themselves. Food, it just, since we opened the facility, I've always appreciated my traditional food just like everybody else, but I see it even more different now. At one point we were served beaver meat. And then when I asked one of the elders, is everything okay? And he just thought at myself to leave them alone, that when they're eating their food, it's not traditional food, it's spiritual food. And wow, that was very enlightening to me. And I think if we practice cultural humility, then we treat them more as not only as cultural beings that they are, but just as individuals that are still living life. I always tell the staff, they're not being put away, they're still living. They still have a lot to contribute and are. So it's our job to allow that to happen.
Thank you. Thank you, Agnes. That's incredibly important. I'm going to move on, and I want to, this next slide has to do with the empowering benefits of what we've been talking about on this webinar today. And I would like to invite Dr. Ferguson to talk a little bit about remaining in the community and the importance of home.
Thank you, Debbie. We look at nursing homes and the movement to facility-based care, because often families can't care for their elder back at home because in our cultures, at least from the culture that I come from, we like to care for our elders, and often due to the constraints of the family and the needs, sometimes we can't do that. And elders, by and large, want to be home. And so if they can't be home, how can we create home where they're at? And by asking those questions, as Agnes shared, by really stepping outside of ourselves and kind of our worldview, how do we step into their worldview? And so how can we make the experience in our facility as close to home as possible? And that's going to be individual by the elder. But at the same time, there is a goal for many elders is to go home. And in Alaska, the Alaska Native Tribal Health Consortium and our palliative care program, which really is a more expansive view of palliative care in today's world of really looking at wraparound services and helping people have the highest quality of life no matter where they're at on their journey. And often, we are working hard at helping train our people in our villages, our community health aides, our providers in our small communities, and then also using telemedicine and using technology to bring care back home again, should an elder or a family be able to work at bringing that elder home. Because many elders do want to go home. They want to have the community surround them. We have so many cultural practices that are based upon having elders home. And many of our communities are facing a deficit without having elders home. Like in our home region right now, and we're working very hard to address this, is we have more elders living in our city than in our region. And so we're working very hard at bringing elders home and having the best quality of care for them, and also educating families about what it means to have a quality of life for our elders, and to not be afraid of caring for our elders. So I feel like it's one that we also need to understand that not all of our elders are going to want to stay in facilities for their entire rest of their lives. But while they're there, we want to make it as close to home as possible. Thanks, and I'll hand it back to you, Debbie.
Thank you, Dr. Ferguson. And I think, Agnes, you wanted to talk a little bit on this about the benefits to the elder, family, and caregiver?
Okay, yeah. Can you hear me now?
Perfect.
Okay. We have been in business for almost 8 years now and have really grown, and there has been so many benefits. And by the way, the practice of cultural humility and having a culturally sensitive home actually started in day one. We started by, adopting a mission and a philosophy of how we were going to do business. And that really helped. But, practicing that, the benefits have been on so many levels, to caregivers. They're more empowered. Our caregivers are many times very unprofessional, as would be said, paraprofessional people that have become really professional in their own life to their families because they're engaged in the care of their loved ones, to the youth because they're expected and invited to help with the care and help with the activities, to the communities because, we still have our elders, as the heart of our community, right along with our school and the kids that are being educated there. But most of all, the benefits to the elders. The elders continue to live very active lives where they are still really important and, included and utilized in the community for all the wisdom and experience they have gained throughout their lives. We create a forum in which they can pass that on. And it's been tremendously exciting. None of these things, that I have really expected. they're being cared for by their very own, because our young people are working in an environment where they are respected for who they are and what they bring to the table. And, when I say we, I mean leaders kind of let go of, how we've been taught and educated and, taught to believe in a Western world. So it's really, really exciting even for me. I should be retired, but I love it. And it's because we are honoring people for who they are.
Thank you very much, Agnes. Joseph, would you or Dr. Ferguson like to also speak at this time?
Just real quick, yes, thank you, Debbie. This is Joseph. Excuse me, Doctor. The one message I'm trying to convey in my goals on being part of the Rainbow Board of Directors is not educating our tribal leaders about the necessary benefits and the necessary change in philosophy from the institution, so much based care model to as a more what we're trying to, our mission would unite to try and provide more culturally based services. It's just a real challenge because, again, being a Medicaid facility, we have to work within the constraints of the federal government and state government, and we're doing our best here. But again, that having our tribal leaders fully educated about what the workings and the processes of a nursing home and the administering of the care to the elders, for me, is really necessary part of what the work I'm doing, so that we can again provide all these benefits that are listed here, the improved quality of care. The tribal leaders, in my situation, base the level of care on the bottom line, and they're not seeing the big picture where, in my view, that more investment in this, our elder care facility, needs to be made, such as rewarding our CNAs, because they're receiving some of the lowest pay in the nation for our providers. So having all the pieces, the dominoes lined up, so that tribal leaders understand the value of rewarding the caregivers, because there's a lot of words put forth by our tribal leaders to the effect of our elders are our greatest resource, or our elders are our highest value. And in my opinion, in my humble opinion, again, tribes in my case, aren't investing fully as they should. But again, that's my job, to educate tribal leaders and remind them of the fact that they can improve the quality of life for our elders if they really, really thought about it and learned about it. Thank you.
Thank you, Joseph. And Dr. Ferguson, I believe there was a comment you wanted to make on some of the benefits of nature and the importance of nature.
Yes. And as we did pre-work on this topic, we were talking about, in Alaska right now, the spring is finally happening, and the birds are almost amazingly loud as far as we spend some time outside. And elders, when we think of, I think all elders, but I think from an Indigenous perspective, that connection to nature is really important for many of our elders. And so, making time and creating time to have space outside And we talked about, elopement and wandering, and perhaps is this tied to an elder's desire to be outside more? And in our structured worlds, we, as providers, often we have our goals that we're going to be doing each day, and we got to get this done, we got to get this done, and those are all really important. But we also need to look at the pace of what's the best for the elder that we're working with, and finding ways to create space to have time outside. And that nature truly is medicine, and the more that we study it, the more that we understand time in nature is crucial for well-being, and especially for elders as we look at maintaining quality of life, and perhaps it will even assist us in medication management and keeping them settled, and maybe not wandering as much or eloping. So the value of that can't be understated, and we have to look at our schedules and our sometimes our ideas of what's important, and really ask our elders and finding ways that can allow them to spend time in nature. Thank you.
Thank you very much, Dr. Ferguson. I think were there any other final comments before we get to the poll questions by any of the speakers? Okay. Julie, would you like to introduce the poll questions, please?
Okay, at this time, everyone, we have a set of questions for our audience members. To respond to a question, you can type in your response in the box just below the question. It says type your answer here. If you can go ahead and just type in your response at that time.
And we truly do appreciate your feedback. We do use this information to enhance our programs. We'll take about maybe 15, 20 more seconds to answer the poll question. I believe there are 3 poll questions today. Thank you very much. We're starting to get some answers. For example, webinars like this and annual trainings on cultural diversity. We do appreciate these answers very much. Brief presentations at orientation, and then ongoing opportunities to be part of educational presentations, events, and ceremonies as appropriate. So we're up to about 30 answers right now, so we totally appreciate people contributing to this discussion. A lot of them say webinars, so we're happy to always hear that. We're up to about 34 answers right now, Julie. Trainings, webinars, and workshops were mentioned. Thank you for your feedback. Yearly and orientation training on cultural competency. Reading materials and storytelling were also mentioned. Hiring locally from within the community. Training, networking, long-term support service training. So we have about 40 answers, Julie, if you want to go on to the next question.
Okay, and the next question is, how are your program staff This next question is, give an example of how elders in your programs are empowered and benefit from culturally appropriate practices. And again, please type in your response in that white space just below the question.
So how do elders feel empowered? How do they benefit from the practices we talked about today? One of the answers was to feel safe, which I think is an excellent answer. And we do appreciate the feedback, and you're taking time to type into the boxes. They settle in faster, decrease in behaviors, and more open communications. There was an answer that it creates peace. Elders are taken to events in the community where they are honored. They guide policy with customer survey completion. They feel like they are listened to. Feelings of inclusion, quality of life. They guide policy with customer survey completion. I think I also said that one. Asked for their input. We're up to about 13 answers right now. Elders feel respected, which helps to develop rapport. Okay. Excellent. Thank you all for that feedback. You want to go to the next question, Julie?
Okay, and the last question is, what challenges have you experienced in developing and implementing culturally appropriate care practices within your programs? Again, to give a response, type in your response in the white space just below the question.
So again, challenges in implementing the things we talked about today, and we truly appreciate any feedback and answers that you can give us. I'm starting to see some poll answers come in. For example, language was one that was mentioned. Lack of support from maybe administration or board members. Everyone having their own idea of what is appropriate culturally, keeping staff engaged. Diversity of beliefs and influence of colonization, acceptance, mistrust, the requirement of individualization for each resident, lack of understanding of the resident, of language, diversity, earning trust, okay. Every elder has a different view of their culture, so it's important to know how they want things done. It talks about community-to-community differences. So we got about 19 responses. Thank you very much for sharing. We totally appreciate that feedback. All right, Julie, I'll let you take it from here. Thank you.
Okay, great. Thank you, Debbie, and thank you to everyone who participated in the questions. We will now have our question and answer session. So if you have a question for any of our participants, please type in your question in the Q&A box that is just below and to the right of the presentation slides. Okay, again, if you have a question for our presenters, just type in that question in the Q&A pod that is just to the bottom right of your screen.
Any of our speakers, we're all happy to answer any questions that we can or a discussion that you'd like to have.
Okay, so we did have one question come in, and I will go ahead and read the question aloud and have the group respond. So the question is, this person is in Alaska and has had a hard time getting cultural leaders in the community to participate in the activities. What would be a good approach to encourage the cultural leaders participating in activities?
Okay. So any of our speakers would like to address that?
Just to share, this is Joseph Wray in Laguna, Pueblo. Just to share with the group, it really has to go back in the investment of the community, where the place our elders hold in our communities. And you need to, at times, remind communities that they do have an obligation to include the elders as residents of our nursing homes in some of the process and some of the ceremony that goes on in the home community. Here in Laguna, Pueblo, for example, we have our medicine men bless our center annually, and it's a tradition that's been going on for the 30 plus years of our facility. So the local clans leaders will come and bless the facility for us. And on June 15th, Laguna Rainbow Center will be having a fiesta. Because of the religious beliefs here, we've incorporated the local custom of having a fiesta for the community. So we have traditional social dancing at this event, and many traditional foods like what we call feast burgers which many of our elders grew up on. And so again, it's again just again a way of us maintaining some of the local ties to the culture, and the religious leaders again are aware of this need, and hopefully again in your work in Alaska you can be able to reach out to the local leadership and whomever you might need to bridge that gap to bring in the bring people in with that craft. Thank you.
Thank you, Joseph.
This is Agnes, if I may. Oftentimes I find it's as simple as extending a personal invitation to a local leader. Serving food, and traditional food is always a big one, but also with that invitation, giving them a little responsibility, like, can you make this? Or I know you make this really well, and the elders would really enjoy it. And maybe it plays on a little guilt, but then that eventually leads to a commitment.
Thank you very much, Agnes. Would anyone else like to comment on the first question? Julie, do you want to read the second one?
Okay, great. So the second question that came in, this individual can relate to how cultural humility has been integrated into the nursing home environments to a certain degree, but that certain difficulties still exist when seeking healthy placement into non-tribal facilities. She works with elders that live outside of the reservation, and she finds herself facing barriers when dealing with placement. Some elders do not want to return to the reservation for various reasons, personal or financial, but they do not want to live in non-native environments. Are there any suggestions in working with placement to take into consideration when trying to place elders in the same environment and in separating cultures?
This is Agnes, if I may. We do have elders from our villages that are, for various reasons, living in the cities, sometimes not by their choice or by their preference. And one of the things that I have found that has been really helpful is to make sure the village people, their people, know where they're at and how they can help, but to also connect them with somebody else in that larger community, maybe a family of the same culture that practices, to adopt them, so to speak, to include them in activities and, take them out and, celebrate their birthday or whatever is important to that, but to make that connection. And, people from home can send them little care packages. Those of us that went away to boarding school for our education remember getting those. Elders still really like that. And so, getting them that in that larger non-native community is nice.
Thank you, Agnes. Would anyone else like to comment on that question?
This is Joseph. Just in my experience surrounding the family member or elder, with somewhat familiar surroundings as best you can, photographs, pictures, articles that, maybe one or two, because again, the nursing home, sometimes things tend to sprout legs. So again, but as best an environment, it's hard. My mother was in a non-tribal facility, and she was easy because we went to visit her almost every day. So she didn't really dwell, I don't think, on her surroundings so much. Well, I can't say because she's gone, but she wanted to get healthy, get well, and get home. So again, family is so key. And it's hard again when there's a transportation barrier or our elder being far away from home. It's difficult, and I'm thankful for this forum because again we're working towards that goal of providing these best practices for the greater world, so they can non-tribal facilities can utilize the webinar and call on the experience of this panel. Thank you.
Thank you, Joseph. Any other comments on that question? Okay. Julie, do you want to read the next one?
Yeah, so the next question is, can the panelists recommend any training materials or curriculum for cultural humility?
I'd just like to encourage people to log on to CMS.gov under our Unite website because we do have some best practice reports that we publish quarterly that are there on various topics. And also these recorded webinars are also there. Dr. Lewis, did you want to comment on any other resources?
Thank you for mentioning the CMS website. I would say that's a great resource as well. There is a resource that we've been putting together. It's in the stages of being copyrighted. The best way I've found resources is using Google, but I do have a list of resources I can send and have it available also that I've been collecting over time that I can make available, and we can either put it on the Unite website might be a great resource or location to put it. But also people can reach out to me and I can send them as well.
All right. Thank you very much. Okay. Julie?
Okay. And the next question is, how might a facility address any sense of mistrust among residents and staff or otherwise?
Would any of the speakers like to speak to that?
It's my belief that as many trainings and in-services for our staff is really the greatest educational tool we can use to remind people of that, that we're a team. I think we're reminded that our center has such a dedicated staff that they're willing to overlook many of the tough challenges of working in such a facility. And so, it's just education, having in-services by various groups that can just be helpful in reminding our staff of their role in the elders' life journey.
Mm-hmm.
Thank you.
And this is Agnes, if I may. I think it's really important to practice really listening to, what they might be saying, and to always remember the context and the condition. I think the mistrust might come from history sometimes. And it might come because they have, been traumatized, or it might come from the fact that they have dementia. And, that is a symptom of that. I don't think everything should be chalked off to things like dementia, but to remember that might be the issue. So to treat, everyone as an individual and to get to know them, honor who they are, and just really listen to what might be going on and what they might be communicating in their behaviors. And that comes with, I think, training, but mostly the openness and the willingness to let go and get out of yourself and honor who they are.
Excellent. Thank you, Agnes, very much. Does anyone else want to speak to that? Right, Julie, do you want to pick up the next one?
Yeah, okay. And our next question is, how would the panelists recommend facilitating getting primary care providers engaged with participating and fostering cultural humility?
I think the concern with that question, too, is that maybe some of the providers aren't there for a long time, and so it's kind of an ongoing challenge.
Mm-hmm. So this is Gary. What I would say there would be to have standardized training for any provider that would be part of the orientation process, so that you would cover culture, some specific things relating to the tribal members that you're serving, and kind of a cultural humility 101. I think would be really great to standardize. Having worked at the Alaska Native Tribal Health Consortium, there is a training in the orientation that's a half day of training around culture and Alaska Native cultures, and it's really rich. It's such a wonderful training for any provider, actually, whether it's elders or otherwise, working with Alaska Native cultures, because it helps people understand the complexity and also, being willing to ask questions and sometimes get it wrong. But at the same time, at least you're listening and you understand that that you may never ever fully get the culture that you're working with, but you have that humility to understand that it's a learning journey. And having these trainings in our organizations being standardized and required, I think, are a really great way to get providers on board. Thank you.
Thank you very much, Dr. Ferguson. Would any of the other speakers like to comment on that question? All right, Julie, I think we have one final question.
Okay, our last question is, what would the panelists recommend when there are elders from different reservations being placed in the same facility, in the same area or wing, and is there friction because of the different cultures?
Would any of the
this is Agnes, if I may. Yes. We do have that experience. I mean, a lot of our elders come from a period of time when, the Athabascan Indians were, at war with the Inupiaq Eskimos. And so they come in with that, and we've had, people from those varying cultures within those larger cultures have to be placed together. And I think that's what really helps is to remember that they are individuals and honor both, and respect that history and, and what it has done to them, but to find similarities and, simple things that, they both have in common. And it's the same thing with religion. Some people think their religions are holier than others, and we have to deal with that. And it begins by, I think, listening, but mostly, honoring and letting go, and, modeling respect and expecting respect and hearing their story about why they are feeling that way against so-and-so maybe. And, giving them that freedom to hear that, but to bring it all back to let's respect one another. Because they want to do that, but they have things to get off their chest.
Yes, thank you, Agnes, very much. Would any of the other speakers like to comment on that? Okay. All right, Julie, thank you very much, and I'll turn this back to you for closing.
Great. Thank you to all of our panelists for responding to questions, and thank you to all of you for asking such great questions. So this is the contact information for each of our panelists should you have any follow-up questions that you would like to ask for any of the presenters specifically. And I would like to thank all of our panelists for joining us today and sharing information and resources about cultural humility within tribal nursing homes and long-term care facilities and other programs. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online at CMS.gov on the LTSS Technical Assistance Center website. Thank you again for joining today's call. Our session is now concluded.